Another day, another story. The story of a surgeon. One of the surgeons at the military hospital in Bahmut, Vladimir Pigulevsky, agreed to talk to us. Before he was mobilized at the end of March, he worked at a regular hospital. We talked in a makeshift operating room with 2 tables. It was clean and well equipped, but the monitors and resuscitation equipment were rather primitive. It was quiet in the hospital, because there was a heavy cloud hanging over Bahmut, and it was raining. In such weather the intensity of shelling usually decreases. There were no urgent operations, so Vladimir found time to talk. Fortunately, there are not many wounded this morning. But there were days and even weeks when there were many shrapnel wounds, leg amputations from shelling or mine explosions, and bullet wounds, he says. We had to work 24 hours a day, even 2 days in a row, with not a minute's rest. We only interrupted to eat or go to the bathroom. Surgeon Vladimir Pigulevsky calls the work he has to do scary. Vladimir also sometimes works on the front lines, providing first aid to the wounded. It was very difficult. Sometimes you have to choose between risking your own life and the lives of the wounded guys. I've never seen anyone afraid to die. No one sits and waits, even during shelling. Everyone goes to carry the wounded and give them first aid. Then we put them in the car and bring them here, admits Vladimir. It's not so much psychologically hard as it is simply frightening. Only mentally unhealthy people don't feel fear. The surgeon said that in the military hospital they had to treat wounds that, before the war, occurred once or twice every few years. We didn't attack anyone. Tears and despair of Ukrainians waiting for the annexation of Zaporizhia. Working in an emergency hospital, I saw a lot of deaths. But that was in peacetime. Here I see our guys fighting. The wounds they receive break their lives. It depresses me the most, he continues. It's horrible to see the pain of our soldiers. To see the trauma they suffer in this war. It's the most horrible thing to see the suffering of our country. That's the worst part. The rest is just our job. A few minutes later, a soldier emerged from an ambulance with his arm broken by a sniper bullet. Another was carried out on a stretcher soaked in mud and blood, with multiple shrapnel wounds. Vladimir quickly got up and went to work. The atmosphere in the operating room did not resemble that seen in soap operas. Vladimir and his colleagues were calm, spoke softly and acted quickly, stabilizing patients until the next batch of wounded arrived from the front lines. Thanks for watching and don't forget to subscribe to the channel.